When anybody has joined the industry that is healthcare, they don't join it for some reason other than to provide care to those that need it. The work that they do every day is so specific to the patient outcome that they almost get lost at times in giving of themselves to help those patients. We are there to ensure that they are able to provide for their patients without being taken advantage of by an employer. For the new person coming into the organization, it is an overwhelming information overload. They are hit with policies and procedures and schedules and employers' rules and all these other pieces. And sometimes it's hard for them to recognize that there's this other group that's standing beside them to ensure that their occupational health and safety is protected, their labor rights are protected, their contracts are enforced. When you look at health sciences, we represent 240 disciplines, combined total 25,000 members within our organization. That is a voice that is able to address issues together and get them resolved. Where we sit today, there are threats to our workplace. There are threats being made of a 20% reduction in funding. There are threats that our pensions will be taken away. We are fighting to maintain those pension plans. We are fighting for joint governance of those pension plans. We are fighting to keep the resources flowing to the front line. And that's a fight that we have to win. When you look at the comments that we do make in the media, in our press releases, everything that we talk about does impact the worker. To navigate how that happens, if you talk about political actions that are going on a federal level, or if you talk about a trade agreement that's happening internationally, those all impact the work that happens right at your workplace. As a young worker coming into the workforce, they find themselves in a union, they're not sure what it is, they've never been part of one before. We have been working to protect workers' rights for a long time. We started in 1972 in HSAA, protecting workers' rights, and we continue that work today. As they get comfortable within their workplace, take a look around. There are committees that a worker can get involved in. There's board positions that are part of the union. There's a lot of access points to the union to get your questions answered. Or pick up the phone and call us. We'll answer. And we need to create space for the young workers to come to our tables and express their needs and interests and help us build the future. So congratulations on your new job and welcome to Health Sciences. We are your union. We work to make things safer, to make your workplace more comfortable. We'll see you maybe at a convention, maybe a workshop. We're here for you when you need us.